In the United States, during the time it takes you to finish this book, approximately 125 people will take their own lives. The mental health crisis plaguing our culture today does not stop with suicide. The epidemics of depression, anxiety, PTSD, addiction, and chronic pain are simply expressions of a psychiatric system that is largely devoid of effective methods to deal with the deeper issues underlying the symptoms. Namely, these underlying issues are core emotional wounds, unmet needs of the psyche, isolation or disconnection from one another, a lack of faith in something greater than oneself, nervous systems stuck in fight or flight, and the empty promises of material success, to name just a few. This is not to imply the current psychiatric field is wrong, it's just incomplete. Current pharmaceuticals have their place when symptoms are severe and need to be relieved. However, they should only be instituted while still looking at deeper causative factors and working to resolve them. We have another tool that can greatly help alleviate so much suffering that our current system does not address. And in the specific case of chronic severe PTSD, the data is incontrovertible. This tool works. And this tool, broadly speaking, is MDMA-assisted psychotherapy. PTSD stands for post-traumatic stress disorder. In its classic and severe form, it has been known in the field of combat experience as shell shock and concentration camp syndrome, and this stems from catastrophic exposure to life-threatening events. Today, that relatively limited definition has been expanded to include a wider demographic of people who have experienced a more varied trauma history, where their significant symptoms have still left them severely compromised. When it comes to treating chronic severe PTSD, the current standard of care model, being psychotherapy and medication management, has roughly a 35% improvement rate. Compare this to chronic severe PTSD treated with MDMA-assisted psychotherapy, and it has roughly a 70% cure rate. Cure here being defined as the patient no longer meeting the criteria for PTSD. At face value, that sounds pretty good, as it appears to double the benefit rate. Except it's even better than that. MDMA-assisted psychotherapy is orders of magnitude better. A mild to moderate improvement is better than nothing, to be sure, but it still means the symptoms are present, and they are negatively impacting the person's life in a significant way. The key is the difference between improvement and cure. A cure in this context means a person no longer has symptoms meeting the criteria for even having PTSD at all. So we are roughly going from a 35% improvement rate to a 70% cure rate. That is no small change. This is as big as it gets in the field of mental health. No other tool known to the world today has as much potency and potential to help people heal trauma and instigate change in their lives than MDMA-assisted psychotherapy. Sound promising? It is, hugely. And that is what this book is all about. It is intended to offer you information on one of the most powerful mind-healing agents on the planet right now. As of writing this intro, MDMA is not legal to use in therapy outside of carefully run, very small clinical trials. Thankfully, though, MDMA therapy is steadily working its way through the very last stage of the DEA's federal requirement process to become a legally available treatment for people throughout the nation. As it looks now, we are on track for a greater expansion rollout to increase by the end of 2021 and through 2022 to meet the demand of the people. It's an incredible time for the field of mental health and wellness. We've never been this close to delivering such powerful healing agents to the masses, and I couldn't be more excited. I'm so inspired, in fact, that I've dedicated my life to being part of the process that helps medicines like MDMA become widely available and better understood. Yes, I want to do this for the obvious reason. It will help a lot of people. But there's more to it for me. A set of personal reasons, too. I struggled with severe depression and at one time contemplated taking my own life. It was a medicine similar to MDMA that helped me get unstuck and pulled me out of that state. My sister Trudy was not so lucky.